Okay, hello everybody. Welcome back to This Week in Global Health, or TWIG. TWIG is a live broadcast, so we've got a live audience watching this on YouTube, on Google+, and of course at our webpage, World Wide Web, www.twigh.org. If you're watching this live, you can send us questions and comments, and we'll respond to them at the end of the show. And the best way to send them to us would be through the hashtag Twig on Twitter, and we'll be watching that. But of course, we'll also get questions that you send to us through the webpage. This week, we're going to be talking about the top stories in 2014 for global health. We're going to tell you what we think some of the biggest issues are for 2014. But if you've got your own ideas, if you sort of think, well, I think this is what's important for 2014 in global health, send that at the hashtag Twig on Twitter, and we're going to compile all of the hashtag twigs. Jessica, how does that work? There's some sort of storyfire thing that we're going to do. Could you just quickly fill us in on what that is? Because I'm not quite sure if I completely understand it, to be honest.
Wow, that's a lot of pressure, Greg, because I'm not exactly sure how I'm going to do it yet, but there is a way for us to take your tweets and create a story out of them using Storyfy and a blog. So please send us what you think are the top stories of 2014 in global health, and we would like to put that together and just have some evidence from our community of saying, hey, this is what we think, and because we really want to, it's not just us, we want to hear what you guys think.
We might be wrong with our list.
we could definitely be wrong.
Okay, and we certainly can't cover everything. We're just going to try and hit a couple of the highlights. Before we carry on, I'm going to ask the team to introduce themselves. We'll start with me. My name's Greg Martin. Next up, Jessica. Jessica, who are you? Where are you? And what are you going to talk about today?
Oh, who am I? Wow. That's a pressure. Anyway, I'm Jessica Taff. I am coming to you from the Washington, D.C. area, and it is 2 p.m. here, and I'm going to be talking about the Ebola story, which probably needs no introduction, but I'll still going to tell you about it anyway.
Okay, thanks, Jessica. Next up, Chris. Chris, talk to us.
Hi, everybody. I'm Chris Ronson. I'm coming to you from San Francisco, California, and today I will be touching on the importance of the Millennium Development Goals.
Okay, Chris, keeping up with the season of silliness with the reindeer antlers there. Next up, Sulzan with the hat. Talk to us, Sulzan.
Hello, everybody. This is Sulzan, and I'm speaking to you from India. It is midnight here, and I will be talking about universal health coverage as well as climate change. Okay,
so actually we've got Chris, it's morning time in California, and Sulzan, who's actually in the next day. This is the 17th for you or something. Okay.
She's got 13 hours on me.
13 hours on you. Okay. Next up, Katie. Katie, quickly talk to us.
Hey everyone, my name is Katie, and I'm coming to you from Stockholm, Sweden area, so it's night my time. And I'm going to argue that the biggest issue of 2014 is NCDs, or non-communicable diseases.
Oh, and she's going to argue. I didn't know this was going to be a debate, so things are going to get interesting. Okay, and of course we've got Brian from Johns Hopkins. Brian, quickly tell us what you're going to talk about tonight.
Absolutely. Greetings, everybody. It's 2 o'clock here in Baltimore. I've been meaning to say that for all my previous appearances, but I want to put that on the record now. It's 2 o'clock. So Brian Simpson with Global Health Now here at Johns Hopkins Bloomberg School of Public Health, and I'm going to be bringing you the top 10 news stories, unscientifically based, but our top 10 news stories in global health for the whole past year.
Okay, and so that actually may turn out to be the best summary of what the top 10 news stories actually are. So that, don't go away when you finish listening to Brian. Actually, Brian, we should stick you at the end. In the beginning.
Suspense.
Yes, keep the suspense. And then last but not least, we've got Jimmy or James. He goes by either, I understand. He's a guest on the show tonight, and he's going to be talking about mHealth. James, can you say hello and tell us where you are and who you are briefly?
Thanks, Greg. I'm here at Boston University. Not so sunny Boston University. It's a little overcast today. It's 2 o'clock, and I'm finishing up some graduate work here and working as an mHealth consultant in a variety of really fun projects around the world. And that's what I'd like to talk to you guys and to your audience about today, is just the kind of incredible ways that mobile technology is being used to improve health outcomes everywhere in the world.
Okay, thanks, Jimmy. Right, now over to Brian. Brian, the top 10 stories from Global Health Now. Over to you. I don't know if you could see it on your screens, but a little bug just walked over my camera. So things went dark for a second.
I thought you said there was one on my face. So I was
No. There's a bug on my computer screen walking around, and it might go back over the camera. I'm like watching it. Anyway, sorry for the diversion. Brian, over to you.
Okay, all right. So these are the top 10 stories in global health now, according to us. Dana Kierisman-Myers, our incredible associate editor, who, Greg, I believe you referred to her as a superhero of note.
That's right, superhero of note.
She's terrific, but she did do a lot of the data. So on this, pulled out a lot of our top stories, and then I sort of kind of went with my gut as well on it. So I picked out the top 10 here, and I'm gonna run through them pretty quickly. I know you got a lot to cover, but I'm just gonna jump right in here. Number 10, breast cancer in Africa. So we ran a commentary back in October on this and how it's like really not recognized as a huge issue, and there certainly deserves to be much more attention and resources put to this. Number 9, chikungunya sweeping across the Caribbean, huge numbers of cases, and it's happened very, very quickly all throughout the Caribbean, and that's an epidemic that's not going away. Number 8, e-cigarettes. I think this has emerged as a huge issue this year in particular, both with the access, its ability in terms of a preventive of people using tobacco, or is it sort of a gateway drug into tobacco? And there's huge questions as well about the contents, the e-liquid, and what's in there, and some of the what comes out of the vapors and heavy metals. Big concern there. Number 7 for us, polio eradication. The efforts continue, but there's progress and setbacks, So there's plenty to look forward to in terms of advances there in 2015. And number 6, the WHO brought out their very first suicide report on suicide prevention. So more than 800,000 people die every year from suicide, and some 75% of these take place in low and middle income countries. Going on to number 5, the Syrian health crisis. It continues. 6.5 million people have been displaced from the civil war that's ongoing there, with huge implications for infectious disease and a lot in terms of chronic disease as well, in terms of getting proper medicines to the internally displaced peoples as well as refugees. Number 4, antibiotic resistance. That seems to be in the news almost every day. We're tracking all sorts of stories on that, and it's becoming obviously a greater concern. Going on to number 3, we chose the Melbourne Conference on AIDS in 2014 in July, focusing in on key populations, as well as the tragic deaths of researchers that were on board the plane MH17. More than 300 people died on that, if you recall that attack. One of the most senseless tragedies, certainly, I think, of the year. Number 2, climate change. I think this year, more than in the past, we're beginning to see its effects, or registering both its effects in terms of health and also registering on the minds of political leaders worldwide. So slowly, start to see some movement there, especially with the kind of recent, at least steps with the U.S. and China and making some agreements there. And of course, number 1, no surprise to anybody, Ebola. I think that certainly captured the world's attention this year. It's certainly, even in the U.S., that was all you could talk about in October in there. But still, terrible outbreak ongoing. 18,000 cases and nearly 7,000 deaths so far. So that's our top 10.
Okay, thanks very much, Brian. And as always, you can read more about these stories at Global Health Now. It's a newsletter that goes out from Johns Hopkins every year. It's fantastic. We use it a lot. We love it. We'll put a link to the subscription in the show notes. So, and I think we've got a link to it on our webpage. If we don't, we're going to stick that there. And Brian was telling me, Brian, can you just tell us about if people are interested in those top 10 stories, you're going to put together some kind of summary of them. Can you just tell us how that's going to work?
Yes, absolutely. So if you want to, please go ahead and subscribe. Toward the end of the year, we'll be sending a compilation of these stories, sort of our top 10 stories, all in one email. And in March, we actually will go live with the Global Health Now website. So we won't be trapped in our little email, but we'll be out there for all the world to see. So hope you'll join us then.
Okay, looking forward to that. Thanks very much, Brian, as always. Right, next up, Jessica. Cheers, Brian. Take care. Jessica, talk to us. You're going to talk to us about Ebola virus, the Ebola virus story. Of course, it's been a big story this year. Can you just kind of give us a little bit of a summary? Why has it been such a big story, etc.?
Yeah, well, Brian gave a good introduction to it. I mean, he said, yes, Ebola is what everyone has been talking about. I mean, in the U.S., but across the world. Now, this first started in West Africa when news broke of the Ebola outbreak. This was back in March. But it went largely unnoticed until it carried on for months, uncontrolled, unthwarted. And this is vastly different than previous outbreaks. The outbreak, as Brian mentioned, has since caused nearly 18,000 infections with 6,000 or 7,000 deaths. And while it has stabilized in some countries, it's far from controlled. And Thomas Frieden, the director of CDC, commented that his worst fear is that this outbreak could become endemic in that region.
Jessica, could you perhaps just address the question as to why the story, the 2014 story of Ebola, is about more than just the epidemic itself?
Right. No, I mean, and that's really important to hone in on, because all right, there's so many things to mention about this story, about things that were happening around it and what it revealed about our global system. So I would say it's worth mentioning how much attention this got attracted in the media. And I'm going to talk about that too much, but I would have a lot to say on this in the discussion. But really important is that it revealed this gross inadequacy in our global preparedness, response, and coordination against infectious disease threats around the world. It brought to light how important health systems are to fighting disease, because there were very weak health systems, which is why this outbreak was uncontrolled in West Africa. And also really mentioned how connected we are globally. The inability to contain Ebola in Africa led to outbreaks in the U.S. And it will continue to be a risk until we get that epidemic under control. And finally, I think another really important thing to mention about the Ebola story in general is how it instigated a fantastically rapid scientific and evidence-based response to develop vaccines and drugs and to test them, and also to use evidence and science to quell the fears that have been going on within populations about the risk of Ebola infection. So there's just so many things that Ebola brought up, and people will remember Ebola in 2014, but they'll remember it for a lot of other reasons besides the fact that the outbreak was happening.
Right. And there's already been talk about, in a post-Ebola era, there being a stronger WHO because of the recognition of the fact that the WHO really is the only institution that can coordinate a global response to this kind of pandemic. And that's a role that they should certainly slot right into. Sulzan, you're going to talk to us about universal health coverage. Could you first just tell us, for those people that aren't quite sure what that means, what do we mean when we use the term universal health coverage?
Absolutely. So the idea behind universal health coverage is to reduce health inequity across the over 7 billion citizens of the world by ensuring access to quality basic health services for everyone without the risk of financial ruin or a financial catastrophe, which happens a lot in countries, especially in countries such as India, where there is a large amount of people, 70% of people in India, for example, pay for healthcare services out of pocket. So that is what universal health coverage is, really.
Yeah, and I mean, we know that there are some countries in the world where the number one reason for going into abject poverty is unforeseen health expenses. So that's incredibly important. Sulzan, can you quickly tell us why you think this is a big story for 2014?
Yeah, this is a really big story for 2014 because this year marked the 2-year anniversary of the landmark UN resolution which endorsed universal health coverage. Where Margaret Chan called it the single most powerful concept in public health, and it's really important to understand that because universal health coverage can improve the economy. In fact, Larry Summers of Lancet Committee on Investing in Health called it the most compelling investment any government can make in its own economy. There have been tons of reports which say that every US dollar invested in healthcare, in universal healthcare, in lower and middle income countries would return between $9 to $20 worth of economic growth by 2035. And just because this year we awakened to the importance of universal health coverage, that's why it's really important. In fact, this year we celebrated the first ever universal healthcare coverage day. So that's why 2014 was a big year in terms of UHC or universal health coverage.
Thanks very much. Very good. Now we're going to talk to Jimmy. Jimmy, I wonder if you can just start by telling us what is I think we've all got an idea of what mHealth is, but could you just hit us with some real fact? What is mHealth?
Well, Greg, you're probably all right, because mHealth is really an umbrella term that covers just a very wide range of uses for mobile technology and health. And that's everything from mobile phones, a very simple Nokia 3310 bricks that we all remember from maybe the late 90s and early 2000s. Everything from those to tablets to wearable devices, and recently, some kind of outside the box things we might not think of traditionally as mobile technology. So it's really an umbrella term, and you're all probably your varying ideas of what it is are probably all pretty much right.
So basically, any kind of technology that has somehow connected with your health that you take with you, right?
Exactly.
That goes where you go. That's mobile mHealth.
Yeah, and it's really another interesting way to look at it is that when we talk about health, a lot of us think of kind of the medical system and healthcare, but if we go back to that 1948 definition of health from WHO that we all know, that kind of expanded version or a broader definition of health to include not just the access of or the absence of infirmity, but just a general well-being. Mobile technology has been used to kind of address all facets of human wellness. It's not just response to disease outbreaks.
And how high tech does the technology have to be? I mean, so if I had an umbrella, that's protecting me from the rain, so it's good for my health, and I'm walking around with it. Is an umbrella mHealth? Well, I'm just being facetious.
That wasn't on the list of questions that you told me. I wasn't prepared for that one. I'll get back to you on that.
We'll get back to you on whether an umbrella is mHealth. Okay, no problem.
Yeah,
Listen,
but I think you raise an interesting point though, and it's a common misconception. I think that the higher the technology, the kind of better the intervention or better the outcome. And really, I would argue mHealth has been used for over a decade now. And if you were to ask me what the most important piece of medical technology has been in the last 10 to 15 years, I'd have to say that Nokia 3310 brick phone that's basically indestructible and can send text messages. And I'm not sponsored by Nokia. I want to throw that out there. It's just a really great piece of technology that's just doing so much good in a wide variety of uses. So I think really when you're talking about these interventions, these mHealth interventions, especially in a low resource setting, really you want to shy away from the high tech and really go as simple as possible. It's the kind of Occam's razor of mobile health and healthcare.
Right, and of course things like cell phones in a continent like Africa have become ubiquitous. I mean, it's a sort of most people either have a cell phone or have access to somebody that has one, and cell phones, as we know, are a great way of getting information back and forth. Jimmy, mHealth 2014, one of the biggest stories. Could you perhaps put that into a bit of context? What's happened in 2014 that has kind of brought our attention to mHealth?
Sure. Well, I think a lot of your, American and maybe European viewers will have heard about, will have seen the rise of these wearable devices, these Fitbits, the Apple Watch, which was announced, which is going to be released theoretically next quarter. So we've expanded beyond just cell phones and tablets, and now there are these kind of monitors that you can wear that look at your movement, your heart rate, all sorts of kind of lighter biometrics that can now be compiled to give you a better picture of your health and wellness, and they're being interfaced with smartphone apps and websites that kind of incorporate behavioral health models, so that now we're actually getting these kind of consumer-based interventions that are really looking at things like nutrition, looking at things like physical activity, a lot of the things that I don't want to spoil Katie's part of the program, but a lot of these non-communicable disease risk factors where we as health professionals have been working so hard to address them, and so if to answer your question, in 2014, mHealth is really from a privatized commercial consumer perspective really made some huge steps on some really big and important issues.
Right, and as the marketing department at Apple know, I buy everything they sell. So when that watch comes around, I'm quite sure.
We really don't have a choice, do we?
Yeah. I think the marketing department at Apple have got a photograph of me on their wall, and when
Yeah,
they're
but
having a bad day, they just look at that and they think, well, at least one person will buy anything we sell.
But Greg, they're doing, in a lot of ways, they're doing the marketing for us. I mean, we joke about this, but if somebody gets really excited, Christmas Day in a couple of weeks, if somebody's getting an Android smartphone for the first time and it's a cool new gadget, it's exciting, they're creating their accounts and browsing the web and signing up for Twitter and Facebook and following us on Twitter, of course, the first thing. Of course. But right after they do that, maybe they download an app that helps them track their calories in a way that that companies like Apple and Lose It and Fitbit probably understand as much or even better than us professionals.
Yeah, interesting stuff. Wow. Okay, that's food for thought, if there was. We're going to move on. Chris, you're going to talk about the Millennium Development Goals.
And that I am.
So firstly, just tell us, what are the if people don't know, what are the MDGs, or Millennium Development Goals?
Okay, so back in 2000, the Millennium Development Goals were set forward. There's 8 of them, and they range from having extreme poverty to halting the spread of HIV and AIDS and providing universal primary education, all by the target date of the end of 2015. And this is to form a blueprint agreed upon by all the world's countries and all the world's leading development institutions to encourage more and better global health and living conditions.
Okay, so Chris, what's the deadline? So the Millennium, I mean, I know the deadline's changed actually, but what is the deadline that we're working toward at the moment in terms of the MDGs?
So we're staring down the barrel of the end of 2015, and there's actually a countdown. As of yesterday, it was 1.04 years until the MDG deadline. And if everyone remembers, I think we covered it on Twig, but we definitely did a lot of Twittering. On August 18th, there was the 500-day countdown. So sort of a marker to get everyone re-involved and bring it back to get more advocacy towards attaining the goals.
Chris, how close are we to achieving the Millennium Development Goals? I mean, which of them have we hit the nail? Which of them are we not even close?
Currently, only 3 out of the 8 Millennium Development Goals have been the ones in relation into poverty, slums, and water. So relating essentially to in areas of poverty and hunger, also in sustainable environmental progress. Only 3 of the 8 have been met. So we still have a lot to do in another year. I know that's got a lot of people sort of apprehensive about whether or not we're actually going to succeed, but they've put forward a number of reports for both after 2015 and for the remaining 370 so days.
Okay, so Chris, what happens next, right? So 2015 ends, we've achieved presumably to a certain extent some of the goals, some of them not. What's the next step? 2016 and onwards, what are the next set of goals that we're going to be aiming toward as a global health and development community?
So of course we'd like to satisfy all 8 of the goals set forward. So again, we have a lot of coverage that we need to get. But they have released the post-2015 development agenda, and that's going to be available through a link in our show notes. And it's definitely worth a look because it sort of highlights how we need to focus on sustainability and building on all of the lessons that we've learned so far, our setbacks, and the successes that we've seen.
Okay, interesting stuff. We're going to move on to Katie, because Katie was going to make an argument, which implied this whole thing was a debate. Quite interesting. She's having an argument, perhaps with herself, that NCDs are the biggest story. So she's actually even competing with Ebola virus. Biggest story of 2014. Katie, I'm looking forward to this argument. Over to you.
I didn't mean arguing with someone. I meant I'm going to make the case because this is the biggest wrap-up story. So I didn't mean it to be competitive. Sorry, Ebola. But basically, NCDs, or non-communicable diseases, are anything that isn't transferable between 2 people, so is not transferable, hence not communicable. And these diseases are grouped together, and they're ranging from mental health to cancers, injuries to diabetes, anything like that are what is under the category of NCDs.
Okay, all right. So let's move on to why this is a big story for 2014.
Right. So in general, it's just made a lot of noise in the recent years. So NCDs are currently the leading cause of death worldwide, accounting for around 60% of all deaths globally in 2008. And contrary to what you may think, 80% of these deaths occur in low and middle income countries. And this isn't just because China and India have really large populations. This is in developed countries as well, where there is poverty and low socioeconomic status. We're finding a really high prevalence of NCDs.
Okay, so basically you're arguing, if I can use the term, that there's been this kind of almost an awakening to the fact that, I mean, that NCDs is this big problem, representing more than half of the contribution to the global burden of disease. Whereas historically, I mean, certainly when I was studying public health back in the day, communicable disease was certainly the biggest contributor to the global burden of disease. So interesting stuff. Katie?
There's been an awakening there, and there's also, just to let you know, it's going on the increase, and it will increase by 17% in the next 10 years are the projections. Okay. And 27% of this will be in the African region. So again, just seeing that this is just a really important issue that's growing rapidly, and I don't think that we're prepared for it.
Okay, all right. I was actually going to say to you, hit us with some facts and figures, but you've done some of that. Any more facts and figures you want to hit us?
I have one more.
One more? Okay.
Yeah, you always have to end on a good note. So although this sounds really daunting, 80% of diabetes and heart disease and 1/3 of cancers are preventable with the right tools and knowledge and strategies, which we know about, but it just takes about implementation. This is all about lifestyle changes. That's what NCDs are so difficult, because this talks about smoking and exercise and good eating habits and things like that. So this is really, it's there. We've got the answers. We just have to implement them.
Okay, ending on a good note. I like it. We should make that a bit of a tradition. Like make the last item of every week something that's positive. Okay, so listen, if you're watching this live, don't go away, because we're going to answer questions and comments and have a bit more of a discussion going forwards. If you're watching this on YouTube or you're listening to the podcast, this is where things are going to end for you. So we love you. Don't do drugs. Always do your best. Don't ever change. Always use a condom if you need to. Just a quick. So before you go, don't leave us yet. Just a quick announcement. Of course, we've got a podcast if you're watching this on YouTube, but you'd prefer to be listening to a podcast. We have that. You can find it on iTunes. Just look for This Week in Global Health. We've also got a link on our webpage if you want to subscribe to the RSS feed on your Android phone. We've got show notes. So if you want to read the show notes and get all the links and URLs to the web pages that we talk about, you can subscribe to our show notes at our webpage. And you can actually subscribe to our show notes in a number of languages. So we're having the show notes translated into Spanish, French, Portuguese, Arabic, and Chinese, and you can subscribe in any one of those languages. We're also going to have the show notes not too long from now available as little ebooks, right? You're going to be able to go on, and where we've done a topic, like we covered recently, we talked about access to medicines, we're going to create a little ebook on access to medicines in all 5 languages, with the videos embedded and the show notes and the links all functioning. It's going to be very fun. So watch this space. That'll be excellent. And the last announcement that I want to make is next year, early next year, we're going to be doing occasionally we're going to be doing a show that we're going to call the Innovation Hubs. We want young people that have got good ideas, be it research ideas, intervention ideas, or just maybe it's a product, but innovative ideas that you think will impact the global health space, but you do not have funding, right? We want to help you. So what we're going to do is we're going to bring people with new and interesting ideas onto the show. We're also going to have a panel of experts to work, and we're going to do all of this live, by the way. We're going to have our live audience engaging with us as well. We're going to work with that person, develop the idea, and then hopefully also run crowdfunding campaigns to try and get a little bit of startup, some seed funding to get these ideas off the ground and up and running. Anyway, so it should be a fun project, but we want people that have ideas to get in touch with us. So go to our webpage. There's a page at our webpage called the Innovation Hub, and send us your details, and we'd be excited about getting back to you and getting in touch about these things. Okay, that's all for now. If you're going to stay on for the ongoing discussion, if you're watching this live, don't go away. Goodbye.
Also,